Hey everybody, it's Mo. Welcome back to the channel, One Mo Kidney. It's been a minute, and it's all I can say is I've gone through a lot of stuff over the past year and a half. A lot of ups, probably a lot more downs, but I've made it through some of these tough times, and I'll talk about them, I think, when I'm more comfortable in doing so. But I just wanted to take the time and, as you can tell from the title, reflect on my time on the transplant surgery service as a medical student and transplant recipient myself. I came in with high expectations. I came into medical school kind of wanting to be a nephrologist and kind of treat patients in that way. But before the beginning of this service, I told myself, why not become a transplant surgeon? Legit, I was telling myself, if not anybody, or if anybody, why not me? Why leave it up to other people to treat this patient population that I'm so passionate about? And so I went into this service and still in this ring telling myself, I'm gonna do surgery, why not? And so I'll probably talk about this a little bit at the end. I don't know if that's still the case. Still got a lot more medical school to see. I think nephrology may still be at the top of the list for now, but it was one of the most incredible experiences of my life being on transplant service. And, I came into this service just, wanting to learn as much, talking to as many of the physicians and fellows as I could about what got them into it, what they're doing, as well as just the technical aspects of transplant and what all that entails. It's truly incredible. And I've been doing some research now on the side with the transplant department here at my school and connecting with them in that way, and then being on the more clinical side of things, as well as having my own, history with this patient experience. I've kind of gone full circle in it, even if my service was only 2 weeks, and it was, I think, like I said, I probably said this, I don't know how many times I've said it, but just incredible and inspiring. And, one thing, I really came into this, I don't want any of it to, be about me, if that makes sense. So I didn't really tell any of the patients or anything that, I'm a transplant recipient. I think a lot of them are coming to the hospital and, their transplants are the biggest days of their lives. And it should be about them, and they should enjoy it and celebrate it. I remember there was one patient which I shared it with, and it was because I was talking to him the morning before his surgery, and I was asking, normal questions, checking in, how he's doing, anything going on. And I think I said something like, I forget what, but he really opened up to me. He's like, man, if I'm honest, I'm nervous, man. It's been 5 years, 5 years on dialysis. He said last time they tried to go for a surgery and it didn't take, or it didn't work out. And so I think this was his second time attempting transplant, and just, real nervous about it. And so I could tell it was like really bothering. So I shared with him that, I've been on dialysis. I'm a transplant recipient, and I can empathize and understand, some of the fears and anxiety he was probably feeling at the time. And it was just, we had a really nice conversation, and it was, I don't know, it just gives me so much life just to be on this provider side of things, if that makes sense, and seeing it from a whole different perspective. And I have such a newfound, respect. I already did, but just newfound respect for these transplant surgeons. Like, oh my God, how incredible these people are. Just the sacrifices they make in their training and in their daily lives and in their time. And I'm sure with their families, just to be here for patients and just to be there whenever they need it. Like, you'll never know when you'll get a kidney. I think I myself went on one procurement, across the state, but I think they go on like 3-4 a week. They went on the jet a couple times during the week to like New York, Philly, Wisconsin, all around Ohio, Indiana, Kentucky. They've, went across the country. And so there's a cold ischemia time, which I think like you want to minimize, lack of blood flow to the kidney. You want it to stay well perfused, things like that. And like, so time is of the essence in these transplant. transplants. And so sometimes these surgeries are at midnight, sometimes they're at 4 a.m., sometimes, you don't know. And just to be able to commit yourself to a life of that is just so incredible to me. And like, so I already did. I don't think I understood just enough of how incredible these doctors are. And I guess I'm not sure how long I've been rambling as usual. I guess one thing I'll leave with is I remember we were finishing rounds one day and we were coming to a patient, liver recipient, and the surgeon was talking to him and asking him, how he's feeling and what he's going to do now that he's got his transplant. And the guy's like, I don't know, maybe spend time with my family, see more time with my kids, travel, see the world, stuff like that. And the surgeon was like, yeah, whatever you do, man, make it count. You got a new lease on life. It's a second chance, and you really ought to enjoy it and, make it count. And it was so just beautiful in the way he said it. This surgeon is so like, intimidating, incredible man, but like intimidating and serious. And he said this like just so genuinely and beautifully. It really touched me and honestly made me reflect a little about, my own life. I'm telling myself, man, why am I enjoying my life more and seeing more of the world and doing things like that. So in a way, that kind of got me thinking like, hey, if I do transplant surgery, I don't know if I'll be able to take much of that advice for myself, So who knows what the future holds for me, for, anyone watching this, life takes you in some incredible places, and incredibly, sometimes it can be, super tough and hard, like a lot of this last year and a half was, and sometimes it can be incredible. At the end of the day, I'm always working on it, but I'm trying to stay centered and humble and grateful for every part of it, every part of the journey, because it all makes up life. And I'm just so blessed to be living that, I'm just reminded of it every day. And as hard as school is and as hard as the day-to-day can be, it's been, just an amazing journey. And I couldn't ask for, I couldn't really ask for much else, genuinely. Of course, I've been through some tough times and awful times that a lot of my peers haven't, a lot of people haven't. Then again, who hasn't been through their own tough moments and times? And, that's part of life. That's part of what makes life so fragile, but at the same time, so beautiful. I think I'm just repeating the same thing in just sentences, but God, life is amazing. And so if you've watched this much, thank you. Sorry for being absent, and I appreciate all of you out there, anyone who's ever watched a single video or, yeah. Hopefully, I'll see you again soon. All right.